Great, I think we'll go ahead and get started. So welcome everyone to the final live engagement of the 2023 COVID-19 Recovery for Routine Immunization Programs Fellowship. The team and I are excited to bring to you today this special support session to help you craft a strong strategic proposal. Again, before we get started, I just want to run through our Zoom webinar logistics. First, again, please use the chat box to introduce yourself and to provide your comments and experiences throughout the session. If you do have a question for our session facilitators or the fellowship support team, we kindly ask that you share in the Q&A module. You can be sure to upvote questions that you'd like to be answered. And then hopefully at the end of the session today, we'll have some time for Q&A. So again, we encourage you to submit questions throughout the session so we can be sure to address them by the end. So for today's session, we'll begin with just a quick recap of the live engagement series overall, followed by a presentation on incorporating gender into your strategic proposals. And then we'll end the session with a panel discussion with some previous fellows and mentors. We'll also have time for Q&A both after the gender presentation and then at the end of the session. So we'll be sure to, again, address your questions then. And then we'll wrap up today's session just with a few next steps, including timeline and deadlines. So before we jump in, I just have a poll question, which hopefully you'll see in just a second on your screen. So we're curious how far along you are with drafting your strategic proposal. So we'll just give everyone about 20 or 30 seconds. Great. So I think you should see the results on the screen, but it looks like about 45% of folks haven't yet started. A little bit over half are currently drafting, which is great to see. And then we have just one person that's already submitted, so congrats on doing that. You still have a couple more weeks, but this is great to see, and hopefully what you hear today will help you, again, with drafting your strategic proposal. So with that, I'm going to hand things over to my colleague, Laura, who's going to just go over the live engagement series. So over to you, Laura.
Thank you, Liz, and welcome everybody. It's great. This is our final session as part of this live engagement series. So on the next slide, I'm just going to briefly go through, I suppose, the topics that were covered over the past 4 weeks. So the idea behind the strategic proposals is that you will incorporate aspects of these topics, either one particular aspect or different aspects of these topics in your proposal. So in the first week, we kind of gave an overarching reason why we're doing this fellowship. We want to see what we can do to catch up those who have been missed. So we covered the big catch up and also the strategy around reducing missed opportunities for vaccination. In the second session, we covered life course integration. These are areas that interlink, with catch up and how you can consider ways in which you can catch up those through other services, or also consider catching up others outside of your typical age groups. Then we had a session on vaccine acceptance and demand, which I think taught us ways in which we can communicate better with those who maybe are hesitant, and also how we can capture information related to why there are issues around vaccine acceptance in our communities. And then last week we had the session on reducing zero-dose children, which showed us reasons why there are zero-dose communities, ways in which we can try and reach those, and also the urban immunization aspect, which was discussed by Ibrahim last week as well, which is oftentimes, as many were discussing in the chat, different urban communities are sometimes treated more differently because of the way in which they access services or don't have time to access services. So these were the topics that we covered, and I hope you got to understand some new aspects and some new guidance that have been released over the past year or so. And on the next slide, I wanted to highlight where you can access the recordings and resources that were shared from each session. So you go to the Boost community, you go to the particular one for this fellowship program, and under the resources tab in the learning group, you can click on the resources, and this is where all the recordings are, and also in the resources tab, you can find the key session resources also. So this is definitely something I would hope that you can access when you're putting together your strategic proposal, because I think if there's certain aspects you want to catch up on, I want to emphasize that the resources in particular and the guidance documents that we shared, a lot of work went into those, and I hope that you can try and take some time to review certain aspects of it, because this is where there's key information, key examples, and also references to other materials. Next slide. Also, we want to make sure that you're aware that there will be a survey for the first phase of this fellowship. It will be it'll be shared by October 9th, and you'll receive the survey link. You have to complete by the 9th of October, and you'll receive this after the session ends. And I want to let you know that we do take on board the feedback that you share, and we have certainly made changes from the fellowship we did last year. So we do definitely take your feedback on board. So please take your time to provide realistic, I suppose, feedback that can help improve this fellowship. I know that some people want different timings, but we're trying to make sure we have this at a particular time where we can reach people in different time zones. But if there's any other particular feedback, we really appreciate you taking the time to do that. Next slide. And next, we're going to go through some of the criteria for the strategic proposal that I think it's important to share with you. So for each proposal, there are sections, and you'll be evaluated on how complete you address each of these sections. So there's a background and context section, objectives and justification, methods, budget and timeline, and outcomes. And within each of those sections, we do give some prompts as to what kind of information we want to be included. So we want to ensure that you do have some references or country information that you share as part of those sections. And then as part of the overall assessment of the proposal, we want to make sure that you're aware that we will be looking at clarity of how you articulate and present the information within your proposal. The relevancy, are the proposed main activities suitable for your country context? Also, the feasibility, can these activities be conducted within the time frame and by those that are listed as being those involved in the collaboration? And are you able to get the resources needed, to actually implement these activities? So that's an important one to consider regarding feasibility. And we'll also be looking at the depth to which you have described your strategic proposal. Have you used relevant resources and data and considered gender barriers? And Michaela will be presenting on that just after this next couple of slides. And then impact. Will the proposed activities contribute towards COVID-19 recovery? So these are certainly things we want to consider. And overall, we're hoping to have a good balance of male and female participants, and also balanced representation from different regions and countries. Next slide. And this is an important topic, so these are the reminders. So you all have access to the strategic to the submission portal, so you are able to draft your proposal. We also have some FAQs to answer commonly asked questions around the strategic proposal. So make sure if you have any queries to check that first. The deadline to submit this proposal is October 9th. And if you have any questions, just email info@boostcommunity.org, and they can direct you to any information that you may be lacking. And with that, I'm going to pass over to Michaela, who's going to cover how to incorporate gender approaches in your proposal. Thank you.
Thanks so much, Laura, and hope you can hear me. Hi, everyone. My name is Michaela Manna. and I work as a gender consultant for the immunization, vaccine, biological department at WHO. We would like to hear from you, like before we start, and please use the chat and tell us if you have and how you have incorporated gender into your proposal, so we can also discuss that and also reply to any answers that you might have. Next slide. While you're writing, we'll start with the presentation, and then we'll read some of your comments. So today we'll discuss why gender matter for immunization, try to explain some of the main gender-related barriers to immunization, explain why it is important to conduct a gender analysis, and go through some gender-responsive approaches, and also share with you some resources and some tools that we hope can be useful to integrate gender in your proposal. Next, please. So you're very familiar with that. We are asking you if you have identified gender-related barriers or concerns in your proposed activities, and how do you plan to address these gender-related barriers? So next, please. So before we start, I just wanted to make sure we have in mind, like we clarify two concepts that are often used interchangeably but are different. So we refer to sex as the biological characteristics and biological attributes and physical and physiological features that are normally assigned at birth based on the appearance of external anatomy and genitalia, while next, we refer to gender more as a social construct. So we refer to all those norms, roles, relations that, of course, can vary from a society to society and can evolve, and are often hierarchical and often reflects unequal relations of power. So it's really important. These two concepts, of course, interact, but are different. So it's important to remember this difference. Next. So why we're talking about gender, why it is important to consider gender in our immunization program. So we often hear that global studies have not found major sex-based discrepancies in immunization coverage. This is often true, but this does not tell us also the whole story, because sometimes this same data, if it's further disaggregated, for instance, at the regional or district level, can actually tell us another stories, and we actually might find some discrepancy. So, for instance, boys have a higher coverage, or girls might have a higher coverage. So there is an association between childhood immunization uptake and gender inequality, and it is important to remember that, and that's why it's also very important to collect sex disaggregated data, that it's also disaggregated also at the regional district level and not only at the national level. Next, please. And while it is important to remember this, it is also very important to remember that it's not only an issue of coverage difference between girls and boys. So it's really about recognizing all those gender-related barriers that can hamper the access and also the uptake of vaccine, especially in zero-dose community, so to reach zero-dose children and mixed community. So it's really about higher coverage for everyone, and this is really important. Next. So how exactly does gender impact immunization? We refer to gender-related barriers to immunization that operate at multiple levels. So it's not just the individual, it's also the household, it's the community, it's the health systems. And all these barriers are underpinned by power relations and lead to different opportunities and limitations and challenges. And this is particularly true for women and girls. Also, very important to remember that gender is not just about women and girls. but it's true that they're often disproportionately affected. And so gender barriers are also divided like into supply and demand side, and we'll look at them in the next slide, please. So here is a summary on the main gender barriers that we encounter on the demand side. So when we, that refer to health-seeking behavior. So we already mentioned the fact that sometimes boys might be prioritized over girls. Or, for instance, women in some areas are not allowed to travel alone due to social-cultural gender norms. There might be a stigmatization of receiving the HPV vaccine in some community. Or sometimes, women, even though they're considered the primary caregivers, they are the primary caregivers, they're not able to control the household resources. Or we know that often in some community, gender roles, the housework, it's mainly on women. So sometimes they have to decide whether to go to work or vaccinate the child. And it is also true that women's lower education and literacy levels are associated with, a lower motivation to vaccinate their child. Next slide, please. So when we refer to the gender barriers on the supply side, we refer to the barriers that we can encounter when it comes to provide immunization services. So, for instance, what can happen is that government are not prioritizing gender into immunization programs, or there might be communities that can impose traditional gender norms, which hinders women's and girls' participation in health services. Or in some health facilities, for instance, the attendance by women, it's they're not encouraging the attendance by fathers. They're stigmatized if they bring the child to vaccination. Or, for instance, in some settings, only female vaccinator can access households to vaccinate the child, and we see that quite often with polio campaign. And those same female vaccinators are maybe can face gender discrimination or threats. Or there might be, the low quality of service in general that can discourage women from attending. So this is just a snapshot, very a summary to just summarize the main barriers that you can find. And I'm sure you're very familiar with many of those barriers. Next, please. So what do we do once we have identified those barriers? We have to collect data. We have to start with a gender analysis. So we have said that we collect data, sex disaggregated, gender-related data. We analyze this data. We gather the perspective from women, men, girls, and boys, and we try to understand what is happening in that setting, community, in that area. And I just want to also clarify that, the gender analysis can happen at different level. It can be like a gender analysis carried out at the desk while, drafting your proposal, using the already existing data, or it can also be an in-depth, on the ground research that you carry out, or you can also ask a third party to carry out the gender analysis. Next, please. So I won't have time to go through it, but just wanted to show you, just an example of type of questions that we can ask for a gender analysis in an immunization program. This is taken from the EA 2030 Why Gender Matters document. I'll share with you the resources, but just to let you know that there are practical tools that you can use just to facilitate this work, this gender mainstreaming work for your proposals. Next, please. Same here, just a list of useful potential resources that you can use. There are plenty of them, so I'm sure they're in your community, in your setting. There are already quite a lot of data that you can find and can be useful for your proposal. Next, please. So here, this is a busy slide, but this is the gender responsive assessment scale that I wanted to share with you, because I think it's very useful for you to understand what do we mean when we say gender responsive, because you know these terms are sometimes confusing: gender sensitive, specific, transformative. This is it provides you this the scale provides you practical example of what do we mean with gender unequal. So unequal, it's a program that really perpetuates gender inequalities, reinforces stereotypes, and on the opposite, we have a gender transformative program. So a program that really addresses the causes of gender inequality and try to transform harmful gender roles and norms and relations and promotes gender equality. So of course, we cannot always, ideally, we should aim a gender transformative program. We can always do that because of many reasons, but it is important to remember that at a minimum, our program should be gender responsive. That's very important to remember. Next, please. Finally, this is my last slide, and here I wanted to share with you some practical examples of what a gender responsive intervention, action, approach look like based on the barrier that for instance, we have found in our gender analysis. So, for instance, if women have limited mobility, time, and control over resources, what we could do is to bring vaccines to places and events that the women visit. Or we could consider extended flexible vaccination hours, or we can offer appointments for all the siblings at the same visit, to facilitate. If, for instance, the problem is gender dynamics in decision-making, we could try to engage and educate men and father as vaccine advocates, or we could promote male engagement in childcare and joint decision-making. So you see, it depends on the barriers, of course. It depends on the context, and what we can do in that particular settings and community and area. This is just examples. It's not what you should do, but it provides you some practical examples so that it's easier for you to understand what a gender responsive action could look like. So in the next slide, I'll just share some useful resources. So the first one is the main source of this presentation. So the Why Gender Matter IA 2030 Immunization Agenda 2030. You can find in the WHO website, both in English and French. And also on this document, we organize a webinar series that you can find at that link, and there's also it's both in English and French, so you can find both the recording. And we really dedicated each webinar, I think it's 5 webinars, to particular topic like health workforce, engaging fathers with best practices from all over the world and different partners. So I think it would be really useful to understand more. And then in the next couple of slides, you have the main website or of the main partners involved in gender in immunization. In the next slide, please. You're very familiar with that, I'm sure. And in the last one, we're also included some links to very useful videos that explain some of the topics that I've just mentioned very quickly in this presentation. And also these videos are available in English and French. So I hope this is useful. And maybe I'll just stop there and see if there's questions in the chat or in the Q&A. Okay, so the first question is about having more of female as vaccinators. It is not what we're already currently having, because if you look at the females are dominating the health workforce. Yes, okay, so this is an important question. It is true. Women are dominating in the health workforce, but not in managerial roles. So they're not in decision making positions, and so they're the majority of the health workforce, but cannot take real decisions about themselves. And so also having more female vaccinators depend on the context. You know, in some contexts it is needed to just enter homes and houses and vaccinate children. In some other, maybe this is not true. So that's why we have mentioned this as a gender responsive, potential gender responsive approach. So I'm reading out the other questions from Nabil. Gender equality is of utmost importance, but it requires social behavior change, which is a lengthy process. In context of reaching the zero-dose children or increasing vaccine coverage, how can we prioritize vaccination over gender equality? As there are few areas, communities where gender equality process will take years. That's absolutely true. And thanks for these very good questions. And we're absolutely aware. I mean, we cannot reach gender equality just with an immunization program. That's absolutely true. But it is also true that if we do ignore gender, we are perpetuates, as I was mentioning before, gender stereotypes and inequality. So maybe with some actions, for instance, with some gender transformative action, we can promote that change. Of course, that change has to come from many different directions. Gender, it's an important and difficult, like a complex, concept that interacts with many other determinants of health. So yeah, you can still implement gender responsive or transformative actions and maybe try and, let's say, contribute to that change. Hope that helps. Okay, so
hi, Michaela, I can help you.
Yes, please. Should I go on, or there's a lot of questions? So
there's a lot of questions. So there's one question in the chat from Pamela that I thought was very good.
Okay.
People, make sure you put these questions into the Q&A. But the question was about how can you make sure that you address gender barrier issues without challenging local customs and traditions?
I know. That's an important and recurring question. So I guess, I mean, this is the fact that we have to, of course, be respectful of local norms and traditions. Is the main reason why we're saying that you have to carry out the gender analysis, because there's no one size fits all, right? We cannot just say you should do that, because in that particular settings, there might be customs and tradition we're not aware of, and the gender responsive or transformative action, it's a different one compared to another context. Having said that, I think that, I mean, when there is like discrimination on disrespectful treatment, sometimes we can try to always gently and respectfully try with small actions, try to maybe change some of the customs that we feel maybe might lead to a greater gender equality. And sometimes, to promote change, even a small change, we should be ready sometimes to challenge, right, the status quo. But you don't have to interpret like promote gender inequality with disrespectful treatment towards the local customs and traditions. There are plenty of examples of programs that promote gender equality tailored to the context where they are implemented. Hope that answers.
Great, thank you, Michaela. And there are two questions that kind of relate to, how do we know if gender inequality is prevalent in our setting? Is there a needs assessment? And on the similar vein, how can you conduct a quick and easy gender analysis where such analysis has not been done? So it's about how can participants understand whether or not gender is an issue in their context, and how would they go about finding out?
They can look at existing data, look at gender equality, main gender equality index that are available. I'm sure are available for your country from main international organizations that are also outside the health sectors like the World Bank or in that list that I mentioned in the presentation, there are plenty of these sources. So this already gives you an idea of the gender inequality that there might be in that country. And then maybe you can use some maybe rapid analysis that have been carried out for similar health issues. Maybe they're not being carried out for immunization, but for another health issues. And so those same barriers most probably apply also for an immunization program. So I'm sure there's a lot of data already existing. And then you can also carry out, a very quick assessment, being sure you involve both women and men. It doesn't have to be an extensive and super long research, in-depth research, but maybe some key informant interviews or group discussions, and already give you an idea of what the main barriers could be.
Thanks, Michaela. And there's an interesting question from Winfrieda, who says that again, it's around having culturally centered issues around gender, but I suppose one thing we want is to see more involvement of males in their child's health. But they said that when some men take their children for immunization, they are mocked by fellow men. And then some men feel embarrassed to be at the immunization site when there's mostly women. So how have other countries managed these issues?
Yeah, I know. Yes, that can happen. You see, when we try to promote change, it always brings some challenges, but that's normal. There are many encouraging approaches worldwide, also in immunization, about engaging men. One, I don't want to say solution, but one, suggested approach could be, for instance, to really try to find maybe a male advocate, a peer that try to, involve other men, and so slowly, this advocate can really try to promote this change in the norms about fathers taking care of their children.
Thanks, Michaela. And there's a comment here by Edwin saying that there's a saying that women deliver and men lead. And don't you think if it is the other way around, productivity will be low? So I suppose yeah.
Sorry, where is that? Can you repeat that again?
So it's saying, it's from Edwin, is saying there's a saying that says women deliver and men lead. And don't you think if it is the other way around, productivity will be low? So I suppose it'd be good to emphasize that, working together is really what we're trying to emphasize. Yes,
absolutely. And why would you say that productivity would be low? It's evidence, it's telling us that it's not the case. And of course, what we're promoting is that also women should have a role in decision making and should work at the same level as men, because sometimes now, unfortunately, the power it's kind of there is an imbalance in the distribution of power and decision making, not always in the health sector, of course.
And that kind of leads on. I'm going to go to a question by Sifaway, who says, it kind of leads a bit to what you just mentioned. So what is the reason for gender inequality in the managerial position? And what would be your advice for women in this fellowship?
What would be the role of women in managerial position? Well,
what is the reason for gender inequality in managerial positions? And what would be the advice for women in this fellowship?
Yeah, well, it goes back to a structural gender inequality in our society. That's it's structural, and it's layered. There are a lot of reasons, you know. And as I said, we see gender inequality in the health sector, managerial sector, but it's not just there. Look at politicians or head of states, right? That because the gender inequality is widespread, and because unfortunately the majority of power it's is managed by men, and that's also of course it reflected in the other sector and the health as well. My suggestions in terms of I would just tell to women in this fellowship to just don't be afraid of not be capable of what your male fellow are capable of, or the barriers that you can face, because I mean we are here to promote both participation and really an equal participation. So just believe in yourself, and because we are sure you're as good as your male partners and fellows.
Yeah, if I may just add, this is Jill Mill. I was just going to say that in particular in this fellowship, both WHO and the Sabin Institute, we are very keen to support female candidates. Any problems you have with regards to participating in the fellowship, please do reach out to us, because we do understand that even though it's just a small fellowship, but it does have linkages to your career growth. So I would really encourage all the women fellows to really participate as much as they can in the fellowship. And you know, these training opportunities are just not individual events. They are something that would help build your skill set, and are in the pathway to your career growth. And as Michaela said, that you know, it would you need to feel confident, you need to feel like you're able as much as your other counterparts. And if you have any support requirements, please do reach out to our team. Thanks.
Thanks, Jill. That's absolutely true.
Thanks so much, Michaela. And I think because in the interest of time, we'll have to move on. But I think there's certainly more interesting questions coming through. But if we have time at the end, we might see if we can address those. But otherwise, I'll pass over to Liz.
Great, thanks, Laura. And I think maybe what we can do as well is set up a question on the Boost Learning Group forum, so we can continue this really rich discussion that we're having, and just appreciate everyone's questions, and also appreciate Michaela for her excellent presentation. Great, so I know we're a bit limited on time, but we do have some 2022 fellows and mentors that have joined us for this series, and we're excited actually to have them join us for a short panel discussion. So we have a fellow and a mentor pair. So Paul Hilarious Abua and Karen Wilkins, who joined us last year. And I just have a few questions for each of them when they were devising, just to talk a little bit more about how they devised, or how Paul devised his proposal, and how Karen, as a mentor and reviewer, what she was looking for in those proposal submissions. So I'll welcome Paul and Karen if they can turn on their cameras. I might pause my presentation. Wonderful. Great. So again, thank you both for joining us. Maybe we'll get started. I have a couple questions maybe for Paul. So maybe just to kick things off, can you just briefly introduce yourself?
Right. Thank you. My name is Dr. Hilarious Abiu. I work with the Ghana Health Service in West Africa, and I'm the Deputy Director in charge of Public Health, responsible for the Northern region of Ghana. Thank you.
Great, thank you. And so just to, again, kick things off, can you share a little bit more about how you devised your proposal last year? Kind of what you were thinking of, how maybe you incorporated some of the learnings from the live sessions during that series into your proposal?
Yes. I think the very first thing I did with my team was to identify the most pressing needs and challenges that were related to immunization in the northern region, because this was the level at which I was operating, which is at a sub-national level. And so this was at a time when routine immunization services were disrupted because of COVID-19 and also the response actions towards COVID-19. Now, once we had done these identification of the most pressing needs amongst all the challenges that are confronting our immunization activities in the region, we conducted a thorough review of our current strategies that were being employed, to deliver immunization services within our primary healthcare architecture. We looked at our policies in terms of how our services were supposed to be arranged, and also look at the data on immunization services. Okay. Now, this ensured that the final decisions we were making were embedded in the data or in some strong evidence of what the current situation was, and also made it a bit more relevant and actionable as far as the northern region was concerned. So in brief, that's how we approached, devising the proposal. Over.
Great, thank you so much for sharing. Can you talk a little bit more? So obviously you submitted your proposal, then you did get a bit of feedback, both from your reviewer, and then I know Karen also reviewed your proposal as well. Can you talk about how you incorporated maybe some of those revisions into your proposal before starting the implementation process?
Yes, indeed. The revision process for me was a learning curve, because a number of the initial ideas we had put together appeared very beautiful until I shared the draft with my peers and colleagues, at the Regional Health Directorate for feedback. And then also my mentor also sent a very thorough feedback on what she thought about what I've been reading. So immediately it highlighted some of the gaps or some of the things that I overlooked in drafting the proposal. So based on the feedback received from my peers and also from my mentor, I had to redefine some of my objectives, streamline the strategies we're going to employ. For instance, in our service delivery for the vaccination coverage that we conducted, and including also, for instance, at some point we have had to drop the qualitative arm of our vaccination coverage survey because of time constraints and resource constraints. So all of that helped to make sure that the final work was much better than the original draft that was submitted to my mentor. In all of this, the important lesson for me was not to be rigid, but adaptable, and also pay attention to detail and maintaining a clear focus on what we want to achieve based on all the learnings that we had acquired through the fellowship. Thank you.
Great, thank you. So my next question was actually around kind of some best practices, quick tips for fellows as they draft their proposals. It sounds like just from your answer, I think two things that stood out for me was one, reviewing with peers and getting their feedback to help strengthen your proposal. And then two, you mentioned being adaptable. So being kind of open for that feedback, making adjustments along the way. Are there any other kind of best practices or tips that you would give your peers as they start drafting and thinking through their proposals?
Yes, just a few more to add. First of all, we need to start early and allocate sufficient time for each section of the proposal drafting, you need to be clear and concise in the writing, because my initial draft was a bit more technical, and it made it difficult for my peers to really understand some of the references and things like that. So we have to rewrite in a language that is that communicates more clearly. Then also, it's important, I'll say, to think big, but start small. The fellowship, you can think big in terms of what you want to do, but because of the resource and time constraints, you have people, then it can be scaled up. Then finally, we need to be sure it's aligned with the fellowship's objectives and guidelines. Thank you.
Great. Thanks so much, Paul. I think those are some really helpful tips. And I know we have a few more questions, which hopefully we'll get to in just a moment. But before we turn it over to the Q&A, I did want to ask a couple questions to Karen, who again was Paul's mentor through this process and also served as a reviewer. So I guess my first question to you, Karen, well, actually first, before you launch into questions, I just want to have you briefly introduce yourself to everyone, and then I'll ask you the first question.
Well, thank you. So Karen Wilkins, as you said, I'm based in the United States. I've been working in immunizations globally since about 1980, including with the Centers for Disease Control and Prevention in the US and the World Health Organization and UNICEF and a few others.
Great. Thanks so much, Karen. So yeah, my first question for you, you reviewed a number of different proposals, and I guess as you were reviewing, what kind of stood out to you, and which proposals were you reviewing were the most strong or the most developed? What qualities did they share?
Yeah, thank you for the question. It's an excellent one. I think what I looked for first was that the person was familiar with the problem, that and if someone is interested in the problem, or even better, passionate about the problem, it comes through as they're describing their it in the background and the context. And so that is first and foremost the thing that made me think that this was perhaps a good proposal. And then the other things would be scale. Paul talked about it just a moment ago. It has to be, you only have 6 months for this project, and it has to be locally financed. So the scale has to be appropriate to the person's role and the amount of time available. For instance, we were talking, there's the life course of vaccination. The children who were missed out on vaccination during the COVID epidemic are now 3 and 4 years old. If you're at the national level, you can address that perhaps by changing policies, if your role is appropriate to that. If you're at a district level, you might have other ways that you would address the fact that children are now 3 and 4 years old who were missed out during COVID. So the scale needs to be something that's appropriate to your role and appropriate to the 6 months and appropriate to the amount of funding that's available. And then the last thing that hopefully was mentioned in proposals is who's going to work on this. So is a person working on it alone? Do they have their supervisor's support? Because even if it's not money, they need to be given permission of their supervisor to have the time to work on this. The supervisor hopefully sees this as developmental for the person, but also of interest to their area, be it national, district, or whatever their role is again. So being able to say that my supervisors, my district chief, my whoever are interested in this and supportive in the proposal is something that for me always made it score a little bit higher than someone who might be working alone. And honestly, there were some people who seemed to be working alone and without letting their supervisor know. That's a really hard thing to do. And it's not long-term if you're working as an individual in any context.
Great, thank you, Karen. And kind of this question, I think you already kind of touched on this a little bit, but how can you ensure that your proposal is really ready for implementation?
Again, already being familiar with the problem means that you're in the right role, you know about the situation, you don't have to gather a lot of additional information. We expect people do need to gather at least some. So for instance, perhaps you know that fathers aren't supportive of vaccination. So, but then your project can be something where your methods include talking to more fathers and finding out why they don't think immunization is important. And then you can address behavioral modification, social mobilization, whatever your intervention would match with your problems. Does that answer your question?
Yes, it does. So I guess my final question to you, Karen, do you have any other tips or anything else that you'd want to share with our fellows as they start crafting their proposals?
It's sort of related to the others. And again, let your passion come through. Don't worry too much about perfect English. If it's comprehensible, the reviewers aren't grading on English spelling or grammar. It has to be comprehensible. So let your passion come through. Make sure that your methods match your problem. If your problem is that you don't have healthcare staff, your solution should not be a demand generation project. Make sure that those two things match. So those are really the only two things that are oh, yeah, sorry. Your methods don't have to be greatly detailed at this point. You'll get feedback from the review process. And if you're selected for mentoring, if you're interested in mentoring and are selected for mentoring, you can get a lot of feedback on methods. Don't leave the section blank, but don't worry if it's still a little bit vague or you're not quite sure how you would do this, because there's some support will be provided.
Great. Thank you so much, Karen and Paul. So I might pause there. I did want to leave a few minutes for Q&A. So maybe first, if there are any questions for either Paul or Karen while we have them on the line. And then if not, we'll kind of open it up to broader questions, either one on the strategic proposal process and submission, or if you have any other remaining questions around gender. I know Michaela has been answering your questions in the Q&A module. We might have time to address maybe one or two more. And maybe I might turn to Laura or Jill Mill if there's any questions that stand out to you. I haven't had a chance to.
Yeah, no, thanks. I think in the Q&A, a lot of questions are still spilling over, but thanks to Paul and Karen for their very good descriptions. There's one question, they're wondering whether the fellowship has identified themes that men can develop their proposals along that line. And it'd be useful, if not this time around, but in future fellowships. But I think, as we mentioned, the live engagement sessions, I don't know, Karen, if you want to talk to that, but given the topics that we've covered during the live engagements, I suppose those are the themes. Yeah, do you want to go ahead, Karen, or
Maybe you can pull.
can you pull up the slide on the live engagement sessions, Liz? The slide that showed the topics that we covered, just so everyone's clear about, I suppose, what the expected. The whole theme around this fellowship is around COVID-19 recovery, and as Karen mentioned, you know, there are children who are, you know, potentially 3 to 4 years old who were not caught up during the time of the peak of the COVID-19 pandemic. So, you know, and potentially as a result, you know, there are children who are susceptible, but also maybe things happened, certain practices maybe became more normalized that maybe health workers weren't doing before. Maybe they're less vigilant or maybe more vigilant over certain things. So it doesn't necessarily always have to be negative. Also, if there are positive things that we can capture, that's also an important thing. And Paul, it'd be great maybe, you know, if you could just, you know, again, just try and emphasize just a little bit how you you know, the decision making for you to choose the particular topic that you chose. Just briefly, just once again, because I think it's always good to get, you know, that kind of insight about how different it was from the proposal, and then following through the mentoring, you know, did things change a lot?
Right. So I think that at the time of the fellowship, I mean, the issue around disruption of routine immunization services because of the COVID-19 was a global discussion that was ongoing. And then at the national and regional level, everybody was thinking about how to restore immunization services, or at least maintain routine services as we respond to COVID-19 pandemic. And so the fellowship, including some other engagements that we had, became opportunities to learn and get ideas to implement. So already, we were already looking for solutions to the problem of the disruption of routine immunization services because of COVID-19. And so that fellowship only came to supply that information in terms of technical knowledge and ideas from colleague participants in terms of how we could go around it. Initially, it was a bit ambitious. We're thinking about doing this across the northern region, but looking at the time constraints, we realized that no, we have to focus on the regional capital because it was the most hit by COVID-19. About 90% of the COVID-19 cases were recorded within the Tamale metropolis. And so if you wanted to test an idea in terms of restoration of services because of the impact of COVID-19, then Tamale Metro was the most appropriate place to test this idea and then share the success story so that others could build on it. So between the start of the initial concept and the final stages, there's some modifications and scaling down of the ideas, but we are now looking at scaling up some of the lessons that we have learned through this process. Of course, I had the benefit of getting my regional director to be part of the team that was reviewing these processes, including my team, both at the regional level and within the Tamale Metro. So all of these collaborations ensure that the project was successful, largely.
Thank you, Paul. I think the message is clear that the more engagement you have with others, then I think the more success we have. And I think it's a very good point. And we've received some questions about budget and is there a ceiling for budget? You know, some aspects of some of the work that you could propose may not require a budget. So you have to think about what is feasible. If you submit a budget of $1 million, I mean, you know, no, that's not really going to be feasible. You have to think about what's feasible within your limits and what's feasible within the time frame, and yeah, just be pragmatic and realistic. I think that's the advice we want to give you. So yeah, and Liz, do we have anything else we have to cover?
Yeah, I did want to just quickly go over kind of timeline of next steps. And again, if you have further questions or concerns, feel free to reach out to info@boostcommunity.org and we'll address them. I noticed there were a lot of questions still around selection criteria and some other kind of basic frequently asked questions. And again, we have all those answers available and we'll be sharing today's presentation slides as well. So you'll have those resources to guide you too. So once you submit your strategic proposal, we'll go through a period of review and selection. So again, we'll have a committee of experts and peers who will review your strategic proposals. Sorry, I realized I'm not sharing my screen. So we'll have a committee of experts and peers who will review your strategic proposals based on the criteria that we mentioned previously. And then the fellowship admin team will provide final review and selection of fellows to proceed to phase 2 of the fellowship. And again, we have kind of limited number of spots. So we will be using that criteria to help guide us. And again, once we finish that review process, you will get feedback and notification on whether you're accepted or not into the phase 2 of the mentorship program. Even if you're not selected for the mentorship program, you will still receive feedback on your strategic proposal. And we do encourage you to strive towards implementing your proposals using that feedback to help strengthen your proposals. And then if you are selected for phase 2 of the fellowship program, you'll continue on from November to March of next year with coaching, revisions, and implementation. So you'll meet on a monthly basis with your mentor with communication in between to help improve and subsequently implement your strategic proposals. And then last but not least, we will ask that mentees submit a final written report on the implementation of your projects and provide feedback on the mentorship program overall. So again, we'll share kind of this timeline and next steps with you tomorrow in the follow-up email. But if you have any further questions or concerns, we can definitely address them. I'll just check to see if there's anything else that's coming in. I think most of them we have answered or are in the process of answering. So yeah, I will pause there. I don't know if Laura or Jill Mill, you had any other final words for fellows as they prepare their proposals.
No further words, but just encouragement and a huge thank you for your active engagement over the past, month or more. We want to emphasize that this is an opportunity for you to consider what you can do in your country context to improve immunization coverage. So it's a big opportunity, and I hope that you will look back on the topics that we covered over the last 4 weeks and really take those into consideration when you're putting together a proposal. And considering the fact that also for those proposals that are considered to be very strong or to have really addressed the main components that we requested, there really is a great opportunity for you to have mentoring following this. So with that, I want to wish you every success, and I'm here with Jill Mills. We can say hello together. No. And we want to wish you all really the very best for your proposal, and know that there is support available if you have additional questions. And yeah, please let us know if you need anything further. Thank you.
Great. Laura and Jill Mill. And I just wanted to thank Michaela and Paul and Karen for their presentations and remarks today. I think that's really some helpful tips for you all as you prepare proposals. And again, on your screen, you can just see a few of the next steps. A final reminder that the proposals are due on Monday, October 9th. And we also request that you take our end of live engagement series or end of phase 1 survey that will be circulated both after today's session when you log off, and then also in the email follow-up tomorrow. So thank you, everyone, and we look forward to reviewing your proposals. Have a great day.